Welcome to Talk of the Bay, KSQD's local talk program brought to you every weekday at 5 p.m. I'm your host, Suki Wessling, and today we're talking about an unusual prescription for fresh air and fun coming at you from medical professionals in Santa Cruz County. ParkRx Santa Cruz County is a multi-agency initiative that will make a reality of health in the parks. ParkRx convenes parks, health care, and community to promote the clinical prescription of parks and recreation programs as key drivers of health, equity, and well-being. The working group is currently staffed in kind by Santa Cruz County Public Health, County Park Friends, and City of Watsonville Parks and Community Resources. Today, we have representatives from all three agencies. Mariah Roberts is Executive Director of County Park Friends, a local nonprofit working to activate the power of our parks. As a co-lead for ParkRx Santa Cruz County, she and her team offer backbone support to participating agencies. Their role is to learn from, design with, and offer support to health parks and community partners to connect more people with the health and joy of nature. Welcome, Mariah.
Thank you so much for having us.
And Kristal Caballero is a project director with Santa Cruz County Public Health and oversees public health's work to equitably advance healthy eating and active living in our community. As co-lead for ParkRx Santa Cruz County, Kristal and her team serve as overall backbone support to the initiative and provide technical assistance to healthcare systems as they integrate park prescriptions as a part of their standard operational practice. Welcome, Kristal.
Thank you so much for having us.
And finally, Jessica Beebe, who is with us over the air, is the Community Engagement and Events Supervisor for Watsonville Parks and Community Services. As a recreation professional for nearly 2 decades, she has planned, implemented, and overseen recreational programming for community members ages 4 to 100. How about 101, Jessica? Jessica has enjoyed the personal benefits of outdoor recreation her entire life and has witnessed firsthand the tremendous impact that time and movement in nature has had on the lives of numerous recreation program participants. Welcome, Jessica.
Thank you. It's a pleasure to be here.
And nice to hear your voice over the internet. So let's talk a bit about what ParkRx is and where it comes from and how people in Santa Cruz County are already experiencing it and may experience it. So it brings a diverse set of players. It's not just one group that has decided to do this, but rather partnership with a lot of different people. So I wondered if I can just start by having each of you talk a little bit about what piece your agency brings to it. And you might tell us a little bit, if it's not obvious like you, Mariah, exactly what your nonprofit does. So why don't we start with you, Mariah?
Wonderful. Thank you so much for the introduction. And you're absolutely right that the power of this initiative is in partnerships. Alone, the medical providers right now don't really have a way to prescribe an outdoor program. Alone, the parks departments don't have necessarily a way for medical providers to connect the people who need it most with their resources. And for us as a nonprofit, we need these partners to have the tools that they need and want and have the support that they need and want in order to deliver this kind of connected programming and to support expansion. So for us as a little nonprofit, we're really excited because we're dependent on our partners and our partners have stepped up.
So, as a little nonprofit, you said, what do you do? What is County Park Friends? You're friendly.
We are friendly. We are. We're fairly young. We're just a few years old, and really kind of launched right before the pandemic. We're the nonprofit partner to our county park system. But what that really means is we're looking at creative ways within the nonprofit's abilities. So bringing in grants, doing, pilots and projects and starting to fill gaps in ways that we can that might be harder for a large, department to try. And so one of the things that's really clear from the strategic plan of county parks and from their leadership is that every one of the parks departments within the county is in our county park system. So you'll notice that our partner here in this project is City of Watsonville, Parks and Community Services, Jessica. And that is not random. That is because we have the support of our county parks partners to really look comprehensively at how each of us, residents in this county, can really get the most from and participate in fully our parks that we all own.
Great. So Jessica, I'd like to bounce it over to you and ask you what your agency, so you're at the Watsonville Parks and Community Services, what do you bring to ParkRx?
Well, thank you for asking. As noted in my bio, I have a long career in recreation services and providing services. And one of the reasons I came to Watsonville is because Watsonville really invests in its community. So early on, I was able to connect with the wonderful partnership here and identify what Watsonville was already providing to the community that indeed fits right into the ParkRx prescription program, which is free to low-cost programming that involves outdoor components. So what we are able to do is identify those and to work with our partners here to comprehensively get that information to medical providers. And I'm sure we'll talk more about it, but Salud para la Gente in Watsonville is a group that we are working with, and they have stepped up hugely to the plate to work with us on that. So we bring the programs.
All right, great. And so finally, Kristal, how does public health take part in all of this?
Yeah, such a good question. And I've been listening to the partners here thinking about that. So I think, with the recent pandemic, folks got an understanding of who public health is and one of our charges, which is to, prevent the spread of illness. And also one of them is to promote thriving, right? Mm-hmm. And so that's one of my roles in the public health division is, we really look at our whole population and the systems at play. Where do people live, eat, work, and play and inhabit their daily lives? And how can we create systems that improve and protect their health, and especially health equity, really looking at who benefits the most from the systems that we currently have? How can we redesign the systems to promote equity for those who had not always benefited? So that's one of the things I do, I look at. And in terms of the ParkRx project, early on, I was one of the conveners of the partners. I facilitated a lot of our meetings. So really took a project manager approach, really just driving the project forward, because what I found is we have such great experts in park design and really looking at the gaps. And one of the roles, I think, for big initiatives like this that I found was really important to play was just to keep us going. There's so much talent. How do we stay together? There's a huge vision. How do we break it down into step by step and make it achievable? Where do we start? How do we scale? Where do we pilot? And so that's been one of the biggest roles we play at the Public Health Department, is just keeping the partners together and keeping the project moving forward.
It seems like that would be a really big role because so many diverse people taking part in something. It could get bogged down in lots of really long meetings where nothing happens.
Yes, that's, definitely a challenge, is how do we have meetings that are functional? And just, again, breaking down that big vision and trying to find those small wins so that we don't get burned out and that we see it. Because, as we'll talk about more, I'm sure, ParkRx is a beautiful vision, and it's happening across our country and across the world. And, Yeah, it's definitely a challenge, but it's been so fun. And as Jessica mentioned, it's just such a great team to work with, and so many who aren't here today who've been a huge part of this as well.
Okay. Well, Mariah, I know that was one question I wanted to ask you. And so about the international origins of this. I mean, I had never heard anything about it until an email from you. And I was like, oh, what's that? And I just thought it was some little local thing that you guys are doing. But no, you're taking part in something really big.
It's absolutely true. I mean, I think that part of what's exciting for each of us in our own way is that this is really a movement. As Kristal mentioned, there is a real recognition that came about. You can read it in articles, in research, in conversation, anecdotally. But there's a recognition from the time of the pandemic to the present that the outdoors is this incredible resource. And I think we saw visitation rates just go skyrocket during the shutdowns. And so it has sort of bumped this conversation forward. Now, the actual movement for ParkRx, started before the pandemic, but because of sort of the increased value, I guess, that people found in their public spaces, it really helped us to forge our partnerships, feel that sort of urgency, and that real focus on equity, as Kristal mentioned. And I think, as Kristal was pointing to, there are limitless ways you could structure a ParkRx program. There are fabulous models that we've learned from. One is ParkRx.org, which actually was based up in the North Bay. Also, the entire country of Canada, who have adopted it as basic health hygiene practice, and that goes a long way. But really what it comes down to, and one of the things I've really appreciated about my co-leads who are here today and others, is that we've really recognized it has to be a local solution. Each community is different. Even within our county, there may be slightly different ways that this is implemented in different communities with different medical providers. But I think we all feel that connection to this movement and sort of international recognition of the connection that we all have to our environment, and that fierce urgency due to the state of the world.
Yeah, no kidding. Yeah. And Jessica, you're in Watsonville, so and I know that as Mariah just said, one of the things that I think is particularly interesting about doing anything related to Santa Cruz County as a whole is that this county is not just diverse in, when people think about diversity, they often think about, the old sort of melting pot thing where there's a pot and it's equally diverse in all areas of the pot. Whereas in Santa Cruz County, every community is very different. And Watsonville especially, if you take the two large communities on either side of our county, you've got two very different communities. So could you speak a little bit about the public health concerns in Watsonville and what you're working with locally?
It's hard for me to speak about the public health concerns because that's not really my bailiwick. I mean, what we aim to do is engage and enrich our community members of all ages. So we've got a Watsonville Senior Center, we've got a number of youth programs, and one of our core values is equity. So, that's really what we're attempting to address. Again, we do have a wonderful partner in Salud, and what we're working towards is actually working with them and their patients to better address specific health issues that they see and gaps that they see in programming that they would in fact engage in if it was created for them and offered for them.
So when you say equity, that's a term that we hear a lot, but what does it mean really specifically to you in your job?
Well, we're really aiming to identify barriers, right? One of the large barriers that we see in our community, one is a language barrier. If we don't have the proper staffing, then we're not able to communicate with our community. But the largest barrier that we have sought to eliminate is the financial barrier. In fact, we had programming that was $15 a year annually. And it included, kickboxing classes and after school programming year round and various other activities. But still, especially when we started working with Salud, we were hearing back from medical providers that if you are a mother of 4 children, that's not accessible to you necessarily in our community. So we actually just recently sort of reimagined that programming, and so now we have what's called Passport to Fun, and it's free, and so people can sign up, and once they've signed up, they qualify for all sorts of different programs. In fact, right now during this winter break that our school district is on, we have a basketball camp that just started this week that's free. All week long for various age groups. We have our environmental science workshop, which is like a STEM program that takes place at various parks in a fixed location that's taking place 3 days a week throughout the winter break. We've got Camp Wow, which is a nice youth program that actually just expanded to include 1 more week. So we have 2 weeks during the winter break. So kids have somewhere to be. They're active. They're engaged. They have great mentors. They're outdoors and doing the ParkRx stuff. So we have that, and then we also have a program for youth in grades 6 through 12 at our youth center, and these are all free programs. So that's really how we're addressing those major barriers that we've seen in our community.
How did you succeed in making them free?
Once again, the city of Watsonville is just, from my experience in this field, they are setting the bar high. We really have found creative and unique ways to fund programs and to offset the costs.
That's great. That's wonderful. Is there a way for the families who could pay to pay, or is it just free for everyone and you find the funding elsewhere?
That's a good question. We do have different programs that are not part of this Passport to Fun. So we have sort of specialty, like soccer programs and leagues and that kind of thing that are more fee-based programming. We do provide scholarships for those, but there's, it's kind of a mixed bag of offerings that we have for the community.
Well, you want a mixed bag so that you can reach everyone, right?
Absolutely.
Okay. Well, we're going to take a short break. You are listening to Talk of the Bay, and we are talking about ParkRx Santa Cruz County, which is bringing together a number of agencies to hopefully improve our public health and improve access to our county parks. And we will be back shortly. And we're back to Talk of the Bay on KSQD. I am speaking with 3 wonderful people from various agencies in the county about ParkRx. And we'll talk a little bit more about that, what it is, but I just want to reintroduce them. I've got Mariah Roberts, who's the Executive Director of County Park Friends, Kristal Caballero, who's Project Director with Santa Cruz County Public Health, and Jessica Beebe is the Community Engagement and Events Supervisor for Watsonville Parks and Community Services. So, Kristal, I wanted to bounce it back to you as far as talking a little bit more about public health and what public health is and why there would be this connection with a program like this. What in public health has to do with getting people to go to parks? How are those connected?
That is such a good and interestingly tough question to talk about what public health is, even though I touched on it briefly. If any of my colleagues are listening or end up listening to this, they would probably have a totally different way to explain. So our charge is to really look at health from a population level. So different from a doctor who looks at a single individual and treats disease, we're in the business of preventing disease and promoting health. through the way that we live. So our everyday choices, what food is accessible to us at our local grocery store? Is our local park safe to play? Do we have street lights that we can walk outside and feel safe? That's public health. And then, of course, as I mentioned earlier, the COVID-19 pandemic, public health is also vaccinations, prevention of chronic diseases, and things like that. But I work in the prevention department, and we look at parks and, again, where we inhabit parks and other things like that. And of course, today we're talking about parks. And so I oversee the CalFresh Healthy Living program. Our role is to increase healthy eating, active living for those in our community with the lowest incomes. And so that's why I talk about the equity approach. And ParkRx comes into play because we know through research across the country, especially here in the Bay Area, actually, where the biggest research is coming from, that the prescription of parks increases physical activity. And so we want to increase physical activity. That's so essential for our health, to move our bodies and to have access to do that. And so that's why we are working on ParkRx to increase the promotion of parks, the utilization of parks, and specifically from the healthcare side, because we also know that a health provider, be it a doctor or a promotora or even a health social worker, medical social worker, we know that those are trusted voices in the eyes of the community. And so we work with those particular professionals to help them learn how to prescribe parks and, connect with folks like Jessica so they know what the resources are and so that they can promote that within their health messaging.
So when you say, that the parks are part of health, what if everybody in our community in the county spent more time at parks, what would you see on a public health level? What would change?
That is such a good question. And that's a visionary question. I don't have data to back that up. I wonder, and I wonder if even any of the other partners here want to address that. Like, what do they see as it influencing health?
What would you hope would happen? I mean, just talking about when you think about the public health aspects that have to do with lifestyle, because this is a lifestyle question to a certain extent, right? So what markers might you hope to see move? For example, we're in the middle of an epidemic that most people don't know of, and that's diabetes. How would you hope that it might affect something like that?
Yeah, that's, again, such a good question. I would definitely hope that we see lower rates of obesity or just overweight, diabetes, definitely. We have just too high rates of type 2 diabetes, which is preventable. And we also know that park prescriptions help increase mental health, decreases stress and anxiety. And that's a big reason that this partnership formed as well, because we know that there was really big mental health consequences from the COVID-19 pandemic. And just increased community connection, increased feelings of safety, increased feelings of trust. And if I were to say my own personal perspective on this as well, and professional, just increased representation out in parks. I want to see more people who look like me out in parks and who look like my family of origin using parks. People of color, people who don't necessarily always see themselves in outdoor ads and public media like that. That's what we want to see, that everyone feels that they have access and that they have that claim to that space. And that's what I want to see as well. And I do think that that's so important for public health.
Yeah, and I think that that's an interesting point, that it is pretty striking when you go to, say, the neighborhood parks, you're more likely, you'll see people with kids there, and so it'll be people who live in the neighborhoods. But say if you go on hiking trails in Nicene Marks, which are theoretically open to all of us, you just tend to see people in a narrower range. And so you hope that this will, how would it change that?
So the first pilot that we're working on with Salud para la Gente, like Jessica mentioned, that is in an area of our community that does predominantly serve folks of color, our more Latinx community. And we know that we hope by really working on that community, those who we will see more using the parks. And then once we scale out, we hope that we see more people as well.
And just to follow up on that, what do you think is the barrier? So just having a doctor say, hey, you should go to Nicene Marks and take a walk, once a week. Why does that remove a barrier?
Yeah, there's so many answers to that. And I would love if folks are able to also answer, the partners here who have so much to say about that. What's so interesting is, and I talk about this a lot, we've also seen in the ParkRx research that the prescription of parks also increases the perception that someone has greater access to parks. So that's a mouthful, but there's a map that we show when we train providers and when we train partners on park prescriptions, and it shows a shading in pink to represent poverty and shading in green to represent public parks. And you can see clear disparities. So a lot of the park equity movement has been about building more parks, building more parks. And we know that in a city like Watsonville, and this is not my cup of tea, this is Jessica.
Well, I'm going to ask Jessica.
Yes.
So finish your sentence there.
We know that we don't have a lot more land to build parks, right? That's not always possible, and it's very expensive and it's very complicated. But we've seen that just prescribing parks increases that patient's perception that they have more access, which is so interesting. I just find that so interesting. And, the prescription, it's the promotion of it, right? It's to say, hey, you have this public amenity that you should use to benefit your health. So that's one thing. And in terms of the initiative, we're also looking at, like Jessica mentioned, the cost, removing the cost barrier. And also we will begin looking at transportation as well. So folks need access to transportation to get there and things like that.
I just made a note on my notepad right here, public transportation. So I'm going to bounce this to you, Jessica, and then I'll follow up with a question about transportation. Do you think that the prescription gives people that helps them overcome the barriers that are keeping people from fully taking part in our parks?
One of the barriers that we have heard from people, and Mariah can speak to this very well from the work that she has done forming walking groups in and around the Live Oak area. But, Mariah, feel free to chime in whenever you'd like. But we definitely know that in some household cultures, just people have not just been exposed to going out on trails and things like that. They're not comfortable going out just because it's not an environment they've spent a lot of time in. And so one of the things that I know Mariah has done is have local leaders who go out and they lead guided walks. So now you're not asking somebody, oh, hey, there's a trail out here you've never been on. Why don't you go check that out and go walk that 20 minutes a day for the next month, right? You're saying, we are going to greet you. We're going to join you. There's going to be other people there. You get a warm welcome, and you can feel safe in a group environment where you can go explore and know that somebody there has been there before. They know where they're going. And furthermore, there's other people that are in the same boat as you, right? And so that's one of the key things that we have found is a successful tool to help just expose people to new things and to help them feel comfortable. One of the other things, this is kind of a side note, but it's an important thing to note, that we've heard from our community that if there's a spot with a water source, there are so many people in our community who do not know how to swim. And so parents are not comfortable taking their children where there is a water source located there, because if they need to, they're not able to save their child. And so that is a huge thing that I would love to address in our community.
Yeah.
Here.
And Mariah, please feel free if you want to add to any of that. But
well, Thank you so much for recognizing my colleagues at County Park Friends. There's no question that our team has approached sort of how to tackle some of the barriers that we're talking about today, just with a lot of questions, asking people what they like, what they've accessed before, what might make the difference. And I think it brings up a really important point, and this harkens back to something that you mentioned, Suki, a little bit ago, as you said, what is it about the prescription? If a provider says, go to Nicene Marks, this is Take a Beautiful Walk, what is it about a prescription that would make a difference? And in fact, that would be good for any doctor to share with any patient. But for those folks who really don't feel safe or confident or familiar or whatever with a space, even if, say, they could actually get there and have time off from work to do so, there are many, many cases where we really are finding that having a host, like Jessica described, and having it really be a community building experience. So it doesn't have to be a big fancy thing, but our fourth working group partner, Annika Millen, who works with our organization, is actually not here today because she's out leading a walking group in Live Oak. She should be wrapping up just a moment ago. But that is a hosted, sort of moderate level weekly walk where people know they're going to see her or one of our team. They know what they're getting. And over time, it becomes a community where people are really building skill. And maybe then they go off and start doing it on their own. But that has been a really important thing that we've learned through this process together. So, Jessica, thank you for bringing that up. There are financial and transportation barriers. There are a lot of psychological, experiential barriers based in historic racism and all the things. And so we need to address those, and we can.
Yeah, and it occurs to me that when you're talking about the barriers, there's another really big barrier that's been created recently, which is your familiarity with digital tools, because it's just so much of what you see says click here or go to this address or whatever. And if that's not the world you live in, all of that is going to seem like a big barrier, even though it seems small to those of us who do it on a daily basis.
Suki, I have a question for Kristal actually on that. So I was just wondering from your perspective, bringing the health expertise, but just your observations and how our partners at Salud para la Gente have addressed that very issue.
Mariah's putting me on the spot for a question she could well answer herself that she's actually an expert in. So big ups to the whole Salud team who's not here, we would not be here talking about this without them. They're just amazing, and they just jumped in head first with us to build the ship while sailing, build the park while playing. Hey, yes. I wish Darlene and JC were here. They could talk about it. They've been doing some texting. Is that what you're referring to, Mariah?
Community health services.
Yeah. So much health care and health messaging is moving to texting. Little check-ins. I think they do some even weekly or monthly texting, reminders. And that's how they've been promoting ParkRx, asking for patient feedback, which we've gotten so much great feedback on some of the offerings we should have as prescribable. Give us, Mariah.
I mean, honestly, it's that team, right? It's a community health services team. So they can prescribe, but they also get all the prescriptions from the family docs and the nurse practitioners and the behavioral health folks and everybody else, every other provider who's actually prescribing ParkRx. Community health services, they do this for tons of stuff, not just ParkRx. They do it for WIC. They do it for, SNAP. They do it for many things that promote the kinds of, work that Kristal's team, what she was describing public health to be. But they're not letting it go. They're going to call. They're going to text. They speak Spanish. They speak Mixteco. They're going to have, the ability to close the loop. So a provider a physician, for example, may prescribe, but they're not going to go call that family 3 times the next day, right? Yeah. So community health services, to me, I've just been blown away by their that final mile, of work. And we've learned a ton from them. So.
Yeah. And that level of engagement with people, I think that one of the things, when you look at the span of time and as computers got more ubiquitous, there was this idea that we could cut the human connection and it was cheaper just to use computers. And so you had those many years where any conversation you had with the doctor's office was some canned voice leaving a message on your answering machine and everything. And it's really going back now because the research says that's just terrible. That a real human being on the other end is really important. And it's interesting that they're using texting, which of course makes complete sense. I just did an interview with someone in Ukraine, and of course she wanted to use WhatsApp. And I use WhatsApp because my older son, who's a big traveler, he started using it, and he's like, you got to use WhatsApp. Everybody else in the whole world uses it. But when I say to somebody in the United States, WhatsApp, if they're not from an international family, they're like, why do you use that? So texting is huge. So I wanted to follow up. We have another couple minutes before we have to break. I wanted to follow up on the question of, I'm not going to use a derogatory word for the public transportation in this county, but I suppose I could. I know there's a lot of people working really hard to improve it, and I don't want to denigrate their hard work. But the fact is that when my kids were in high school, we homeschooled, and I was like, I'm not driving you around anymore. You're teenagers. You're going to take the bus. And it was hard. They spent a lot of their day on the bus. What is it like to get to parks in this county on public transportation, or if you can't afford parking? So like a lot of our state parks, it's really hard to go to them if you can't afford the parking. So, Jessica, you've been quiet for a while, so maybe I'll bring you in first, and then we'll talk to the others. What's it like in Watsonville? Are people able to get around to the parks that are being prescribed?
I would say people are able to get to the programs pretty well that are prescribed, but it really does depend on the situation, right? A lot of our programs are based toward in and around our downtown area, which is very accessible via bus. It's just funny that you're calling on me because I rode the bus in this county for like 15 years.
Good for you.
And I did find it, you figure out systems, you do. But it is more time consuming than just hopping in your car and driving somewhere. So some of what I think needs to happen is education about how to properly utilize the transportation that is available to us. I think it'd be great for some kind of like training program, honestly, because it is a system that takes some learning. But, our county is large. So, we can talk about Watsonville, but really, if you live in, Boulder Creek, then it's going to be more challenging for you to get somewhere, for sure.
That's true, definitely. Well, we're going to take a short break, and we will come right back to this. This is Talk of the Bay, and we'll be right back. And this is Talk of the Bay, and we've got many voices here having such a great conversation about ParkRx, which is a specific program, but also about our county. And one of the things that's really, really cool about community radio is that we're not being paid to do this. So basically, when I'm booking shows, I'm like, what are people doing? What's interesting? And you don't have to have money or connections to get on this program. And so this is, in fact, a wonderful opportunity for us to talk about our county and what all sorts of people, how people interact with this place that we live in. And so before the break, we were talking a little bit about public transportation and the fact that parks aren't necessarily easily accessible and what accessible means. So I wanted to take a little bit of a turn here and ask you all about Santa Cruz's parks. And of course, I'll have to start with Mariah because this is your specialty. But I know I don't remember the numbers, but I know I've read that we have more open space here than certainly any other urbanized county in California. What do we have here that's special that ParkRx is taking advantage of?
Thank you so much for that question. I think one of the things that's easy to do when we're really trying to meet a need that's unmet is we can feel sometimes like we're in scarcity mindset kind of. And the truth is, one of the reasons that this is such an exciting program is because of where we live. That there are just incredible trails, beaches, and parks, ag land that has some access, public access, etc., throughout this county. And if we can really figure out ways for everyone to benefit and everyone to feel welcome and everyone to have the same kind of access, that is a beautiful thing. And it's making use of something that we already have. That said, we underfund our parks agencies like no tomorrow.
When you say we,
us taxpayers, the way that we have decided over many decades to dedicate funds to our parks departments is really sad. The numbers are appalling.
Yeah, I know that people don't realize how many rangers, state park rangers. So we have huge amounts of state park land in this county. And how many state park rangers do we have?
Honestly, the state park system, I don't even really think about that much because they have much more than our county parks and our city parks.
So I think last I heard it was like 1.5 ranger positions, but I'm not sure. I don't have somebody here from the state, but county parks.
County parks have, I'll just give you a quick number. We have $95 per resident to spend.
Per year. Okay.
San Mateo is like $583 per resident, and Santa Clara is like $835 per resident. We don't have any rangers. We don't have any interpreters, maybe one half. We have 2 parks planners in the entire county park system. It is real bad. Yeah. And so how do you address that? It's a very difficult ask, but what we do have is the places. What we do have is each other. What we do have is the love of the places and these incredible partnerships. The cities within the county, like Jessica was mentioning, City of Watsonville is such a model. The investment that they have figured out how to make these programs possible and affordable and accessible. That's what then invites people out into their beautiful parks, right? And so we can do a lot of things. But one of the reasons that ParkRx is so exciting is that we're starting with very little in terms of investment and so much in terms of potential.
So let me follow up on that. So where do the other counties get the funding for their county parks? Do they have higher taxes, or what is it that they're doing to raise that money?
It gets super wonky, and I can go there with you if you want. A large part of it has to do with Prop 13 and the decisions that were made at that moment in time, back in the 70s, in terms of our tax rate and other counties' tax rate at the time. And then you're set into not only the amount of property that can change, but also the rate at which it can go up. So that goes for our entire county government. It's not just parks. But then within that, our county parks have 0 dedicated funds.
Okay.
So that means the moment that the recession comes or some kind of dip comes, it's the first place that gets cut.
Wow.
So it's just really rough. That said, I really believe that as part of this movement that we've been talking about, that recognition and that reality, people are really starting to understand that. And I actually think there's really a sea change of like recognition for we have to invest in these places that then just come back in spades to care for us, that connection, and especially when you look at our future in terms of sustainability. So it's tricky. It's a tricky question. And I'm happy to go there if anybody wants to talk about it more. It's really not that fun. But there are really good people, both in the public sector and the private sector, in terms of the nonprofit world, who are involved in sort of the eco world, who are all working on this. We are really intent on making some changes. So,
well, a couple weeks ago on my show, I had 3 people who are in nonprofit fundraising, and we were talking about how many great nonprofits that we have. Especially, we were talking about Santa Cruz Gives and how it. For those of you who don't know about it, go to santacruzgives.org. I believe we can give to County Park friends there. And you know how many great nonprofits there are doing things that in other places public agencies do. so the County Park Friends is one of them, you know, that you're saying taking up the slack for funding that should be there but isn't there. And you know, I want to bounce this to you, Jessica, because of the fact that you just got huge praise for the wonderful parks in Watsonville. So talk up your parks a bit.
Oh, wow. All right. So do I get to talk programs, parks, whatever I want? Or?
You know, you've mostly talked programs. So how about talk about a few of the parks and what they have to offer?
Yeah. Well, we have such wonderful parks with a lot of great amenities, you know, but we don't have a lot of large park space. In fact, if we talked about how wonderful our county is in terms of park space and open space, and it certainly is, but where we're at a deficit in our city is that park space, is that open space. What we have is wonderful, right? We have the slough system, right? That's a wonderful space for people to go, and that is just being improved on and connected more and more so that you know, somebody's going to be able to run a marathon soon, you know.
I want to just interrupt and say that when they had the train demonstration, my husband and I went to Watsonville and took the train into the slough on the tracks that will eventually, hopefully, have a train that goes all the way up through Santa Cruz. And it was just so cool to be back there. Because there's all this area back there that it has been inaccessible for so long, but they've built the rail trail back to there.
Yes.
It's cool.
Yeah, it is really, it's great. I utilize it all the time personally. And it's a space we want to utilize for guided walks, more guided walks. We have some through our Nature Center team currently, but we want to expand on those. Another great spot that a lot of people don't know about, you know, there's 2 Pinto Lakes, right? Mm-hmm. And so there's the city side and there's the county side, and which are both wonderful. On the city side, you can kayak. There are pedal boats to rent and go out. And if you've never done that, you get back there and you don't feel like you're in Watsonville at all anymore. You know, if you're a bird watcher, it's a fantastic bird watching opportunity, but it's just so peaceful and beautiful back there. And I just don't think enough of our community is able to take advantage of it, nor do they just, know about it. Mm-hmm. But one of the things that our director, he is fantastic, Nick Kalabakib, he is so focused on growing the park space. So we have worked to build a partnership with PVUSD, who has been wonderful to work with. So we are able to, some of those campuses that get closed off after there are no more activities taking place there, we have 3 sites that we get to go in and open up and make available to the community. So that's one way that we've sort of expanded that open space where, more activity can take place. But he, along with, multiple other people and agencies, I'm sure, was able to get $23 million that we will be spending on just completely reimagining our Ramsey Park, which is already a fantastic park space. It's kind of our crown jewel.
Yeah, we used that a lot when my kids were little.
Yeah, so I mean, there's tennis courts, there's soccer fields, there's softball fields, there's a skate park, there's a pump track, there's picnic areas, there's a nature center that's going to be renovated to just a state-of-the-art exploration center once it's all said and done. So that's actually, we've just started construction on that project. So kind of some pre-construction, but in the summer of next year, we're really going to kick off getting that park just like completely renovated. We're adding an all-inclusive playground with 5 different play areas. We're adding couple different dog play areas for small and large dogs. As I mentioned, the Exploration Center, we're working on the Slough Connector project to again get that trail so that it's just all more connected, all of our little trails that we have. And just so much more. So that's a really exciting thing that's going on. We've also got a grant that will continue. We'll start working on our plaza. So we're going to be able to add some features to that space, which is beloved by our community and utilized for a number of events throughout the year and just daily use. So there's more coming. So there's great things that we're doing now. There's a lot of opportunity for families to gather and play and just be out in nature. But I'm excited about where we're going.
Mm-hmm. A lot of what you described is pretty typical of more urban cities, that you'll have a small amount of, really nature, and then a lot more things like the plaza, which is a park and which is beautiful, even though it's urban. Mm-hmm. So, and it has its different uses too.
Yeah.
Suki, I wanted to, again, goes back to the health equity that Kristal was talking about earlier. But Kristal, one of the things, despite all that beauty that Jessica was just describing, which is very real and very well used, what do we find in terms of the park acreage, south and north?
Mariah keeps putting me on the spot. And yeah, Jessica mentioned this too. There's so much, big ups to City of Watsonville, Director Nick. We wouldn't be doing this without him as well. The acreage, the inequities around the acreage in our county are appalling. Correct me if I'm wrong, partners, with the numbers, but I believe in the City of Watsonville, it's 2.5 acres per 1,000 residents, compared to the City of Santa Cruz, which is 27. You heard it from Mariah, 27.
Wow.
It's appalling.
And that's a number that really defines equity, doesn't it? When you can just put a number on it, it can be really shocking.
Yeah.
And so, I mean, I guess part of that is just because of the fact that the agriculture is not going to go away, and that's what most of this open space in South County is agriculture. Mm-hmm. So, yeah.
It's definitely a complex issue. That's for another day. But that's why we're working on the ParkRx and the park prescriptions. And, it's not the solution, but why not? Why not do it?
So we have 1 minute left for a speed round. Your favorite park and why? And I'll just start with you, Kristal.
I have a 2-year-old daughter. We spend all of our time now, me and my husband and her, going to parks. I can't choose just one, but I will say Leo's Haven. We're fortunate enough to live near there. Thank you, Mariah and her colleagues, for making that park a reality.
I believe we did a show on that a few years ago.
Yeah.
Okay. And Jessica.
I got to go with Ramsey. My son has utilized the skate park many times, the pump track many times, as my husband, and I've played tennis on those courts so many times. So it's a special one to me.
Excellent. And Mariah.
Seriously, I don't know how to choose one. I really don't. I'm just going to say my favorite for this weekend, which is Felt Street Park, where my colleague Adiera Flores runs a labyrinth rock painting project that's just beautiful. And it's just a little pocket park, but it's such a simple example of what joy these places can bring.
Mm-hmm. Well, thank you all. This has been such a great conversation. And I wanted to remind listeners that not only will we have links to everything that we've been talking about, but I will also put links to some previous shows that we've done here at KSQD about all of the various things that have been happening in our parks. And I want to thank you, Mariah Roberts, Kristal Caballero, and Jessica Beebe for coming in and talking about ParkRx.
Thank you, Suki.
Thank you.